Good evening, everyone. My name is Dr. S. Ellen Ray, president of Elmhurst College. And on behalf of the college and the entire college community, I really want to welcome you and thank you for coming to tonight's important panel discussion. Here at Elmhurst, we're committed to fostering civic engagement among students and in the larger community. While widely regarded as a destination for mind-opening discourse, we welcome thousands of people to our campus each year to hear some of the country's most thought-provoking discussions. Perhaps you've attended some of our events. Governor Edgar has said that Elmhurst College has emerged as a leader among the institutions of higher learning for its determined focus on civic engagement and service to the community, and we're honored by those words. Through tonight's panel discussion, we sincerely hope that you'll learn more about heroin use in the suburbs, education to prevent its use, treatment for those addicted, and what's being done to rid our communities of this epidemic. Again, it's my genuine pleasure to welcome you to Elmhurst College, and I hope you profit from tonight's discussion. I'd now like to welcome the Honorable Lee Daniels, my Special Assistant for Government and Community Relations, who will introduce tonight's guests. Thank you again for coming.
Good evening. As a lifelong resident of Elmhurst, I think a lot about our suburban community and the triumphs as well as the struggles we face. We all enjoy rejoicing in the triumphs, but in order to overcome the struggles, we need to be engaged, informed, and educated on the problems facing our family, communities, and what can be done to overcome them. As Dr. Ray mentioned, tonight we have a panel discussion regarding the Heroin Highway. That's the stretch of 290 that carries heroin from Chicago's west side to the western, northwestern, and southwestern suburbs. Heroin use is becoming more prevalent in the suburbs. A Chicago Tribune article, as a matter of fact, just this past Sunday, talked about and shed the light on bringing the toll of heroin highway on human life. The article highlights the inside story of 11 deaths from heroin use that occurred over a recent span of 10 days in DuPage County. Ages for these deaths ranged from 15 to 63 years. And yes, they were some of your neighbors and some of the people that live in the communities that you live in. The October issue, recently released, of Chicago Magazine has a special use of drug use in Chicago. They report that Chicago is the only U.S. city to rank in the top 5 cities for all major drug categories. Number 5 for methamphetamines. Number 2 for marijuana. Number 2 for cocaine. And number 1 for heroin. This is a report that just came out in the Chicago Magazine, and I invite you to search the web and to read that story. Tonight, we welcome Senator Matt Murphy as our moderator and distinguished panelist. He was elected to the Illinois Senate in November 2006 and was recently appointed to be the Senate Republican Deputy Leader in January 2013. He's an advocate for balanced budgets, job growth, and the return of honest and ethical government in Springfield. Senator Murphy has worked to address the problems of heroin use in the suburbs by moderating panels such as we have tonight. Senator Murphy is active in his community, serving as co-chairman of the Northwest Suburban Alliance on Domestic Violence and several other boards dealing with hope and dignity. A native of Mount Prospect, he's a graduate of the University of Iowa, John Marshall Law School with a Juris Doctor in 1996. Also on tonight's panel is Robert Berlin, the DuPage County State's Attorney. Dr. Kathleen Burke, CEO of Robert Crown Center for Health Education, the nation's first health education center and located in Hinsdale. And Dr. Dan Lustig, Vice President of Haymarket Center, Chicago's largest community-based not-for-profit provider of comprehensive substance abuse treatment services. We'd also like to welcome tonight retired Chicago Police Captain John Roberts. Captain Roberts is a founder of the Hero Foundation, whose mission is to help families of those who have lost a child to heroin. Thank you all to the participants and the organizations they represent. Contact information for these organizations is in your program, and I encourage you to stop by the table in the back to pick up literature about these organizations and the many fine services that they provide. I would also like to thank Laura Anderson, the CEO of Winning Systems, for an invaluable assistance with our program this evening. After the panel shares their insights, we will have a question and answer session so that you may be part of the questions on this important topic. Ladies and gentlemen, please join me in welcoming Senator Matt Murphy.
You know, Lee, you've got a real presence. Have you ever thought about going into public office? No. Yeah. I want to thank Elmhurst College and Speaker Daniels for inviting me to be here tonight for what is an increasingly important topic. And we've got a tremendous panel of speakers tonight. And the point of each of these speakers is to add a piece to the puzzle of the information that I hope you will take with you and evangelize those who are not currently aware of the depth of this scourge in our midst and educate them of this risk and what they can do to fight it. We will start with a testimonial from Captain John Roberts, and I failed to bring my Kleenex, and I suspect based on my past experience at these events, I'm going to wish I had it when Captain Roberts tells his personal tale. The personal toll and the human experience that people suffer as a result of this drug is absolutely breathtaking. And the courage it takes to come and speak to a group about something as personal as the loss of a child to something like this is truly extraordinary. And we're going to have Captain Roberts explain to you and walk you through the personal aspect of this to help get you in a frame of mind of understanding just the evil it is that we're fighting. We're going to follow that up with State's Attorney Bob Berlin to explain what's going on here in DuPage County. There is this perception, and I'm from a similar area up in northwest Cook County, Palatine, Arlington Heights, Mount Prospect area, and there are a lot of people who think if you are from a strong socioeconomic background and have a good family, those areas are immune from this. And the numbers will tell us, and State's Attorney Berlin can lay this out, that that's anything but true. And if you are relying on those as your safety blanket, so to speak, you're relying at your own peril. And Bob will be able to explain a little bit more in detail what we're seeing on the ground from a law enforcement standpoint. I have had the pleasure in the past of working with Dr. Dan Lustig from Haymarket, who is an extremely impressive person. I don't like sharing the stage with him because I'm in politics, and you're not supposed to be on the stage with somebody who does it better than you. Dan does. He will provide an immense amount of information for you. Again, the whole point we want to drive home is take this with you tonight and go let people know before they're in the position Captain Roberts is in today what they need to know to avoid that terrible outcome. And then finally, Kathleen Burke, CEO of the Robert Crown Center, a tremendous organization doing wonderful work in the area of prevention. Again, trying to fight this fight before it gets to a critical stage. So with that, I think we are ready to start with our first panelist, Captain John Roberts. And Captain Roberts, a Loyola University School of Education grad, Northwestern University, Lewis University, Chicago State University, Southwest Junior College, areas of specialization in public safety management, administration, organizational development, police administration, and operations. In 2004, John completed a 30-year police career with the Chicago Police Department, retiring at the rank of captain. During his career, Mr. Roberts acquired considerable command-level experience and very diverse professional experience while working his way up through the ranks and the positions he held in operational, investigative, technical support, and administrative divisions. Throughout his career, Mr. Roberts demonstrated unwavering commitment to higher education and earned those 4 college degrees. Mr. Roberts put his education and professional experience to work teaching part-time at the Center for Public Safety at Northwestern and Lewis. After retiring from his police career, Mr. Roberts accepted an appointment as the program chair of criminal social justice at Lewis University. In 2008, Mr. Roberts retired from that position and is now devoting most of his time to public safety consulting and advocacy for higher ed. He is also the founder of a group called Hero that is helping to fight the heroin battle. And I had the unfortunate result or opportunity to see an obituary of a 29-year-old man today from the south suburbs who died of a heroin overdose. And in lieu of flowers, his family wanted donations to go to Captain Roberts' group, Hero. And without further ado, Captain Roberts.
Tough act to follow, and it's me. But I thank you very much for that kind introduction. I came here tonight, and I have a speech prepared, but when I got here, they asked me, do what you do best. Give the human face to the story. And so I've pitched my speech. If you saw me writing up here, I'm going to tell you my story. I mean, it's not about 40 years of policing, and yes, I'm back in the game. I'm a local police chief, and I'm fighting against all crime and drugs. But I know the reason I'm here, and I think everybody here, every family member knows, and the story has to be told. I lost my son Billy at the age of 19 in 2009. He died September 20th, 2009, so that you know what that means. Friday when I woke up, within seconds. Well, I feel it every day, but that day, as I came to consciousness, it hit me in seconds. It was 4 years ago today I lost Billy. I knew my wife, who's struggling even more, was going to have the same feeling, and sure enough, when she woke up, I didn't have to ask, I knew. I mean, I have 3 other kids, but I can share with you that that day, as I comforted my wife and I was leaving for work and, had her in my arms, but as I looked back, tears were streaming down her face. I knew that nothing I could do was going to help, per se, get her through that day. But throughout the day, we kept in contact with each other. And over this last weekend, it was tough. And with each day that we moved beyond the 20th, we were coming out of it. But I got to tell you, when the Bear game started, Sunday night, September 20th, 2009 was a Sunday night, and my wife said, the last text I sent to Billy was, did you see the game? So clearly, I mean, we struggled through it every day, but with these anniversaries, it was tough. And that night is the night I'll never forget. It's the night that no parent ever wants to live through. As we were sitting there, the game was over, and we were going to watch a movie, and the phone rang. Now, we knew Billy had gone in to spend the weekend with some friends, his childhood friend he knew since kindergarten. He's safe. Billy was in recovery. He hadn't really been involved in heroin long, but it's such a powerful, seductive, and terrible drug. You have to get ahead of it as fast as you can, but in the blink of an eye, as it turns out, we lost Billy. But we thought he was safe there. And we later learned that his friends went to the Sox game, and Billy didn't have the money, so he stayed home. And what we didn't know is that Billy had a small amount of heroin with him. And he was 11 days into recovery from a relapse. He was doing well. But while his friends were gone and nobody was there, Billy took the drug. It's a very powerful central nervous system depressant. And you go off to sleep, and if there's nobody there to save you, then you will go into cardiac arrest and die. So, I mean, that night when the phone rang, Jonathan, his best friend, called us and said, these words are burned into my brain. Mr. Roberts, I don't think Billy's breathing. That's not what I wanted to hear from Jonathan. I mean, we were up and out the door, putting our shoes on and racing to the car and racing across into the city where he was spending the weekend. I mean, I know how to drive fast. I've done it all my career. Halfway there, as we're telling this young man how to give CPR, the paramedic took the phone from Jonathan and said, "Sir, you've lost him." So we kept going. You know, I often say when I pulled onto that street that night, many thousands of times I pulled on the streets with lights and sirens, blue and red going, but this time it was me who had been called to the scene. And you know, the sight I saw, seeing my son there, and then we had lost him, as painful as that was, when his brothers and sisters arrived. And they could tell just by the look. I mean, my daughter, Bonnie, actually fell to her knees halfway down the block, but she knew what had happened. It was the thing we feared the most, and it's the thing that every family who's dealing with a drug problem, especially heroin, fears the most. And you never stop worrying, watching. We work tonight in New Lenox at the Linkaway Christian Church. We have a family support group going. We work with families to try and teach them and help them about this terrible drug and how to get through an addicted family member's problems and how to heal themselves. But the stories we hear from families, twice a month we were there, I mean, you never can relax. The other night, I couldn't sleep on Saturday night. I went down on the couch, and as I went to lay down, I thought, how many times did I do this so that I could keep an eye on Billy if he tried to get out of the house? This drug is so seductive, so powerful. Once you've taken it, if you liked it, it's the most powerful and the most seductive drug on the planet. We had a choice after we lost Billy. You know, I could have crawled into the shadows and just licked my wounds and let my grief take me wherever it was going to take me, but I always say I'm a cop. We run toward the problem. How could I let other families suffer what we suffered? And since that time, I've been fighting, but more importantly, and as you'll hear from these speakers tonight, ladies and gentlemen, we have an epidemic spreading across our community and into the suburbs, deep into the suburbs and across our nation. It is now the leading cause of accidental death in the nation. I refer to it as the epidemic that nobody's talking about. So I was asked to come, and I guess I got your attention, but I want these speakers who I've worked with before, they're all knowledgeable experts. I don't want to steal their thunder, but ladies and gentlemen, please, as you heard, do not leave here tonight and let this be the epidemic that nobody's talking about. Listen to what you're being told tonight. And then I call these people up here my heroes. And the media who carries these stories, my heroes. Please join us. Be a hero. Take a stand against this drug. Push back with everything you've got. I didn't know how to start an organization like Hero. I didn't know how to do a lot of things, but you know what? Doing nothing is not an option. If we do nothing, we have yet to see how bad this epidemic can hit us. But I'm terribly frightened by the idea that it's doubled and doubled and doubled in our counties in the last 5 years. I mean, geometrically growing like that, this is an epidemic that we'd better turn and face right now, and we need your help. So thank you for coming out. God bless for your compassion and your concern.
So now that we have a sense of the personal story, and maybe some of you here have your own personal story, but now we all have one to share. Thank you, John. Now let's get into just how real it is here in DuPage County and attack that mindset that it can't be here, it can't be going on where we've got strong families, where things are going well. It certainly can't be going on in our backyard. So with that, I'd like you to welcome State's Attorney Bob Berlin.
Good evening. Unfortunately, the story that John Roberts told, the tragedy that befell his family, is something that happens in DuPage County every 8 days. In the past 20 months, we've had 72 heroin overdose deaths in DuPage County. 72 in 20 months. In 2011, there were 27 overdose deaths, and those numbers keep growing. We've had 34 so far this year, and we're still only in September. Heroin knows no boundaries. It's not just teenagers, it's adults, it's professionals. We've seen overdose deaths this year from 15 years old all the way to 64 years old. And as John talked about, every socioeconomic part of the community is affected by heroin. And that's what we're seeing in this county. So what are we doing about it? And what can we do about it? We're taking a two-pronged approach. There's a law enforcement component going after the drug dealers and trying to get the users into treatment. And then there's the education component, trying to educate people like yourselves who are here tonight to learn more about the dangers of heroin, how powerful it is, and what to look out for. When we talk about heroin, the heroin today is very different than what it was back in the 60s and 70s. It's far more powerful. And it used to be years ago that there was a stigma associated with heroin. People were afraid to use it because you had to inject it. That's no longer the case. The people today are smoking it and they're snorting it. And they don't have to use the needles, which makes it a more popular form, a more popular drug, a more popular way of people getting high. The heroin that we're seeing, as John talked about, as we heard earlier, is coming. Most of it's coming from the city. There is a heroin highway. The people in DuPage are driving on 290 into the city, and there are numerous drug spots, and for every arrest that's made in Chicago, there's 5 others that are willing to take over that spot. It's a very lucrative business. So when we talk about law enforcement, there's a number of things I want to mention. A few years ago, actually 2012, State Representative Dennis Rebelletti sponsored a bill which lowered the amount of heroin that makes an offense non-probationable. It used to be 5 grams if you're possessing it with the intent to sell. In other words, the drug dealers. That's now 3 grams. So 3 grams or more makes it non-probationable, and it's been a powerful tool for us going after drug dealers. Recently, the legislature also passed the first state RICO bill, the state street gang racketeering and influenced corrupt organization law. And about 3 weeks ago, we made our first use of that bill when we took down a major heroin trafficking organization that was operating in Cook and DuPage County and made 31 arrests. And to give you some idea of the extent of this operation, they were bringing in $2,500 to $3,000 a day in heroin sales. And that's just one organization. And this was about a 4-month operation that was going on between our office, DUMEG, and the DEA. And a tremendous amount of resources went into that investigation, but hopefully with the use of this new law, we're going to make a difference and send a message. The RICO law allows us to go after the organization itself. So we can take drug dealers and we can work our way up the chain to the runners and the people actually in charge of the organization, and we can prosecute all of them in one single indictment and not just send them to prison, but we can go after their assets too. All of the proceeds of the operation can be seized. So it's a tremendous tool that we have. There's also a overdose immunity law that was passed by the General Assembly a couple years ago, which encourages people to call for help if someone you are with is overdosing. You have immunity for 3 grams or less. If the police find heroin or cocaine as a result of an overdose, you can't be prosecuted as a result of that. And it was a bill that I supported because it does save lives, and that's what it's really all about. So that gives you some sense of what we're doing on the law enforcement front. And again, we're going after the drug dealers, not the drug users. And with the drug users, we have in DuPage County a tremendous drug court. And Jean Solon is here tonight, our coordinator, and she does an outstanding job. Since 2002, we've had 600 defendants enter into the drug court. And in this drug court, they get treatment. And they're able to, if they're able to complete the program, they're able to get charges reduced and avoid going to prison. And as a result, they complete the program, they graduate, they can become productive members of society. It's about $3,000 to $4,000 to treat someone in our drug court. It's about $30,000 a year to incarcerate someone. And the research has shown if we send drug users to prison, they're going to do their time, they're going to get out, and the cycle is just going to repeat itself. They're going to get arrested again because they're going to start using again. And we haven't done anything about the problem. So we've really tried to steer more drug users into our drug court and get them the treatment that they need. These cases are staffed by professionals. The defendants appear in front of a judge on a regular basis to see how they're doing, and it's a tremendous program. The idea in drug court is to stop the addiction. And, John mentioned it earlier, there is no drug that's more addictive than heroin. And to give you some idea how powerful it is, if you go out for a very nice dinner, you're going to get 200 milligrams of dopamine. And dopamine is a chemical that basically makes you feel good. It affects the nerves in your brain. So 200 milligrams for a good meal. Someone who uses heroin is getting 1,000 milligrams of dopamine. It's about 5 times the amount. And of course, what happens is you use it once, and you want that same feeling again, and it's very addictive. And time again, people who use it only one time can become addicted to it because it's so powerful. And that's what we're trying to do in our drug court. There's the education component is what we're doing here tonight. This group, John Roberts, Kathleen Burke, Dr. Lustig, we've been going around the county and trying to spread the word and spread the message about the dangers of heroin use, what to look out for and what to avoid. And we're going to continue doing it to deal with this problem because we're not going to give in. We're going to fight it, and we will succeed in eradicating this county of heroin. There is no other way, and we're not going to quit. But that's what we're up against. When you go back to your homes and your communities tonight, please spread the message and tell other people about what you learned here tonight. What we want parents to avoid is the not my kid syndrome. It may not be your kid today, but that doesn't mean that your child is immune from what is going on. This drug is in our high schools. It's in all of our communities. It's here, and it's not going away, but we're not going away soon, but we are dealing with it. And the last thing I want to say, I know you're going to hear more about this later on, is the correlation that the research has shown between pain medication and heroin. There's a strong correlation between people who use pain medication like OxyContin or Vicodin, which then leads to heroin use. So if you have those medications at home and you don't use all of that prescription, get rid of those drugs. Get them out of your house. If your teenage children have an injury maybe because of sports, and they get prescribed this medication, when they're done using it, get rid of it. Because there is as I said earlier, a strong incidence of people using pain medication. It then leads to heroin. So it is a serious problem. This is an epidemic. It's a crisis in this county. We will do what we can on the law enforcement level, but I can tell you right now, as hard as we try and with the resources we have, we are not going to arrest and prosecute our way out of this problem. We need to get the word out, and we need to keep people to stop them from using this drug in the first place. And as I said, with all of our efforts, we absolutely can make a difference. Thank you.
Thank you, Bob, and Bob finished on a great point. You know, those sellers need buyers, and if we can dry up their market, maybe we'll have fewer sellers. Next on the program is Dr. Dan Lustig. Dan Lustig is here. Dan is the Vice President of Clinical Services at Haymarket Center. He has over 20 years of experience implementing quality substance abuse programs. Programming under his oversight includes programs for pregnant and postpartum women with children, victims of human trafficking, adult men with multiple treatment episodes, methamphetamine addiction, men re-entering the community from prison, and adult men and women with co-occurring substance use and mental health disorders. Dr. Lustig currently sits on numerous committees evaluating methamphetamine and its clinical interventions statewide. He holds certification in mentally ill substance abuse and is a certified substance abuse counselor. The Haymarket Center is Chicago's largest community-based, not-for-profit provider of comprehensive substance abuse treatment services. Its mission is to aid people with chemical dependency in their recovery by providing a continuum of optimal professional care that is responsive to the identified needs of the community. You can't have anybody better to explain how this all works than Dan Lustig. Dan, thanks for being here.
Thank you. If you don't mind, I'm going to try to stand because I'm pretty ambitious with my presentation tonight. I've got 20 minutes and 42 slides. My goal really here today is to really educate individuals because that is really the best prevention that you can do, is education. When we looked at all the data, both here in DuPage and the collar counties, I compared the data between here across the data from the United States. We're seeing a lot of trends and a lot of similarities that will help us to fight against this addiction. And that is prevention, and that's going to be the key thing. Many people and many parents do ignore the warning signs, and it's important, and what I hope to accomplish tonight is to get you to understand what those warning signs are and what is considered high risk. What I also hope to accomplish tonight is that addiction is a medical condition. You will find to this very day that many people will look at a drug addict and say they deserve it, they started using it, it's their fault, they get what they deserve. And the reality to this is that we as a group, we as a county, and we as a state have to begin to understand that for the past 25 years, addiction has been categorized as a medical condition. It is also a chronic relapsing condition. And this is what parents and all of us in this room really have to get our arms around, is that it is a chronic relapsing condition, very similar to cancer, and to diabetes. However, we treat it very differently. Perceived risk is a critical element for children to understand. What we are seeing here in Chicago and in the state of Illinois, and that is around perceived risk. As perceived risk drops, usage increases. We're seeing this with marijuana. We're seeing this with heroin, specifically in DuPage and the Collier counties, where we began to look at what these children were thinking about marijuana. They did not think that it was addictive in nature. They did not think that using it one time can get them addicted. And I want to go through this really quickly to show you those components of what causes individuals to be addicted. Heroin is one of the highest dependency liability profiles of any drug. And why is that? Because of what happens when the drug hits our system. And I'm going to say this very quickly. When the drug hits our system and it gets into our brain, the molecular makeup of heroin changes. And do you know what it changes to? Morphine. Our body produces morphine naturally. And so the pieces to this is why relapse is such a major issue, is that almost anything that they do in early recovery can create and cause relapse. Of those who are offered heroin, about 20% will try it, and of those 25% will proceed to dependency. Purity has increased, as you've heard earlier, and many people can just inhale it. It is as cheap as $10 a bag. What many dealers are doing both here and in the city is they're giving it away for free. And the reason why they're giving it away for free is they know that the first, second, or third time they've got you. And if you are biologically predisposed to addiction, they got you the first time. Short-term effects of heroin include a surge of euphoria and clouded thinking. This is what the addict will chase for the rest of their addiction, whether they're in recovery or actively using, is this high that can't be repeated. What we find in heroin users is that it opens them up to other opportunistic infections, including HIV and hepatitis. These are the way heroin can be abused: injecting, snorting, or smoking. Injecting is typically used as you progress in your addiction, because a lot of the a lot of the young people are finding that smoking is quicker and easier than injecting. They will start off in that method. The issue that we find in the young people, 18 to 24, is that when they do begin injecting, they will inject in places that you can't see. They'll inject it in between their toes, under their arms, in areas that is not visible. And so here are your short-term effects. There's a rush, depressed respiration, clouded mental functioning, nausea and vomiting, suppression of pain, and for women that are pregnant, will have spontaneous abortion. Some long-term effects are cognitive deterioration, infectious diseases, collapsed veins, bacterial infections, and abscesses. The more prolonged usage, you have infections in your heart lining. Now, many people would ask yourself, why would you use heroin? Why, knowing you all of this, why would you want to use? And because one of the things I want to tell people here today is that drugs work. You don't wake up one morning and say, today's a good day to use heroin. We use heroin, we use cocaine, and we use a myriad of other drugs because it works. It makes us feel better. And heroin makes us not feel at all. So what we are seeing, and you'll see a little bit later on, is that people use heroin that have trauma backgrounds. People use heroin when they have a level of mental illness that they find heroin helps with. And so to get an understanding about treatment, because treatment works. It works each and every time. For those people that are in DuPage, for those people that are in Chicago, and across this nation, you will find that treatment does work. So typically, what a lot of people feel, parents, specifically politicians, no offense, is that when you look at treatment, people expect that the person goes in, they seek treatment, meaning that they want it, that they complete an assessment, they receive treatment, and they are discharged in a period of weeks or months, and they're cured. That is what people believe, and what we find here in the Collier counties is a lot of our families are spending a great deal of money around treatment not understanding that it's a chronic relapsing condition. And so this expectation that people should be cured after their first treatment episode created a Congress of the United States to create what is called GIPRA measures. And those are measures that say, I want to know what we're spending our money on. And if people aren't getting cured the first time, then why should we as a nation pay for it? And the reality to that is because people don't treat addiction as a chronic relapsing condition, just like cancer. When you get cancer, and thank God we cure it, and thank God when it, or not thank God, but when it comes back, should we be saying to that cancer patient, you had your chance, get the hell out of here? We don't. But with addiction and the stigma associated with it, we do. More than half the patients entering publicly funded addiction programs require multiple episodes of treatment over several years to reach sustained recovery. What we know is it takes 3 to 4 treatment attempts, 3 to 4, to get people into recovery for at least 1 year. So we know that when this person coming to treatment, this is their first attempt, we've got a lot of work ahead of ourselves. Progress of many patients is marked by cycles of relapse, recovery, and repeated treatment episodes. And this is what's going to be key, because as people leave treatment their first, second, and third time, the worst time for a patient leaving treatment is the first 30 days. The mortality of individuals who leave treatment after the first 30 days, they have a 50% chance of dying within those first 30 days. 50%. 1 out of 2. The acute care approach to drug abuse has encouraged people to suppose that patients entering treatment should be cured and able to maintain lifelong abstinence following a single episode of care. Substance disorders typically follow a chronic course, where some 90% of individuals dependents started using before the age of 18, and half started before the age of 15. The reason why this is key right now is we know now, both analyzing this DuPage data and data from the United States, that prevention should target, education should target at age 14. So we know this. We now have to work on focusing the intervention. So this is an interesting slide, and a slide that should be concerned. So in analyzing 1,200 people across the United States, one of the things that we've learned is that the earlier age of usage, the longer it takes for people to get into recovery. So if you see what's going on here, is that in order for someone to reach a 50% chance of not relapsing, it can take close to 20 years. Numerous longitudinal studies have shown that on average, people reach sustained abstinence only after 3 to 4 episodes of different kinds of treatment. And right now, we are having a huge public health crisis when it comes to addictions treatment. Since 2006, the #1 cause of death in the state of Illinois is drug-related deaths. And for that, we don't even make 1% of the state budget. Not 1% of the state budget goes towards treatment. So what we do know is that substance abuse careers are shorter the minute people get into treatment. And so as you look at the green line here, if we can get into people treatment sooner, then we know that we can reach that 50% mark in 5 years shorter. So what we know is that here's part of our issue. When you have earlier age of uses of drugs and alcohol, the worse the outcome is, the longer it takes to get somebody into treatment, into recovery. So looking at the Roosevelt study, where they analyzed part of this in conjunction with your group, they found that there were 3 pathways to heroin use in DuPage County and its collar counties. That was pill use to heroin. That meant that most of the kids in collar counties in DuPage became addicted to heroin because of prescription medication. And this is what was said earlier, where parents did not throw out their medication, kids who might have had surgery and received pain medication. You'll notice that almost every single time someone receives pain medication, they are given more than that is needed. And those pills hang out in the homes, in friends' houses, and that's how they get started. Cocaine use to heroin. So for many people who feel that, you know, my kids aren't touching heroin, cocaine is the next runner-up. So approximately 33% of the suburban youth became addicted to heroin because they managed it by starting cocaine. Of the youth interviewed, all youth involved in the study first initiated heroin use by inhaling it. Many youth thought that heroin use was, this way was less addictive or had no addictive qualities at all. Transition from sniffing to injection was the normal course, and 33% began to use heroin while they were in high school. From the earlier slide, we know that we've got our work cut out for us because these are too young of individuals to begin using drugs and alcohol. So when you look at the age of first use, you really begin to see that over time, people that are younger, it takes a longer period, and you're talking around 30 years. 30 years to have a lifelong addiction is something that people under the age of 24 and even older have a difficult time getting their arms around. People don't understand that when they go into treatment and thank God they move into recovery, that this is a lifelong problem. That for the next 30 to 40 years, you have to have a recovery program. Majority interviewed had little or no idea what heroin use or dependence consisted of or with the withdrawal symptoms associated with it. They just didn't understand what they were using. Majority interviewed had little or no education regarding heroin use and dependency, and more than 75% of self-reported mental health disorders. This is the same statistic we're seeing across this country, where mental health issues are co-occurring with heroin. Mortality rates, as I explained before, for the heroin-dependent person is over 50%, and over 50% of the heroin-dependent persons will be dead before the age of 50, with the mean age of death being around 30. Just an FYI, in the last 2 years in the United States, we've lost more people to heroin deaths than the entire Vietnam War. 1/3 of the sample suffered a significant scarring from injection, amputation, or limb damage as a result of the injection drug use, and half the sample had missing teeth caused by lack of saliva. Most individuals with opioid use disorder have significant levels of tolerance and will experience withdrawal or an abrupt discontinuation of the substance. This is what causes death. Because when a person leaves treatment, they're beginning the recovery process, they cannot understand the proper dosage to take. And so what happens is they wind up taking more and their body can't handle it anymore. And this is why locking individuals up is not the answer. Individuals with opioid use disorder often develop conditioned responses to drug-related stimuli. Someone mentioned a good meal, a steak meal can trigger you. The problem we also have with adolescents is sex. Sex can cause someone to relapse. It is the same pathway that's used and is triggered as the drug. When someone goes out and exercises, we want people to get out and be social, it will trigger the same pathway. So here is something interesting. This will take a look at how long it takes people to move into recovery. Over 86% can move into recovery for 5 or plus years as long as they maintain abstinence. Every time that they relapse, the time starts over again. For those early in Chicago, what we have found is it takes a year of abstinence before less than half can relapse. And that's what is key, as long as they stay in treatment and have some type of recovery program. Even after 3 to 7 years of abstinence, about 14% will still relapse, even if they've maintained a treatment program. The risk for opioid use disorder can be related to individuals, family, peer, and social environmental factors. And so this is where I'll be talking about genetics very quickly, because what we have to understand is if you have addiction anywhere in your family to alcohol, to marijuana, that gives the rest of your children a predisposition to becoming an addict. Now, whether they will or not depends on a multitude of genetic factors. Some warning signs to be aware of are the dramatic changes in one life, performance at work or school, personal care, hygiene. They forget about taking showers. They look very slovenly. Tendency towards recklessness. Heroin addicts do not care about natural consequences of their behavior, specifically the younger you get. They may engage in dangerous activities. Natural consequences of their choices are no longer important to heroin users. So when you go ahead and threaten that heroin addict, it is not being registered. Some additional signs of abuse are runny nose, needle marks on arms, speech is sometimes slurred, very little motivation, and no desire for future plans. Now, many people might say, this is what all adolescents look like. Again, the best treatment is educating. Your risk factors. So when you look at the environment, coming from a chaotic home and abuse, parents' use and attitudes, number one, parents' attitude toward drug and alcohol is critical. And that is what we're even seeing with the marijuana issue in Chicago. And that is, marijuana is looked at as not a big deal. It should be legalized, and was, to a certain degree when it comes to medical marijuana. And what did we see? A huge uptick in adolescents using marijuana. And so community attitudes and poor school achievement, all of this are the risk factors to what heroin addiction, where it roots and where it comes home to. I always have to have a brain slide, as I say in a lot of my presentations, because I think it really gives a key aspect. So under the age of 24, most people, your brain develops from the back to the front. Now, why do we need to know that? Well, because the front part of your brain deals with understanding consequences for behavior, knowing the difference between right and wrong. So why is it that young people tend to go to war? Because the young ones charge towards the problem, charge towards the fighting, right? People in their 30s and 40s, even 50s, most of them will run away from everything. And so that is just development. And so what we see here is that addiction is primarily driven by reward and pain avoidance. And this is the same area that we spoke that deals with eating, sex, are the two big triggers for a lot of our heroin addicts. Adolescent brain development occurs from the back to the front and inside and out. Why that is important is if you see that area where it says pain, this is the area of the brain that in treatment we try to address. We try to get an understanding to. The problem with this, why is treatment one time not enough? That is because this is the hardest part of the brain to get to. The only way we can get to the brain in this manner is through repetition. Addicts hate repetition. They get bored, they say, understand this, and they wind up leaving treatment. And that's what starts the cycle. Again, if you look in the areas of the brain, it's where heroin, cocaine, and nicotine are all activated. Even smoking can cause individuals to relapse and feel a craving to use the drug again. So one of the things we began looking at are prescription opioid sales. As you could see, where sales have gone skyrocketed over the course of time, the last 5 to 7 years, you also began to see a higher death rate occur. So we do know that there is a correlational link between prescription pain medication, opiate pain medication, and heroin addiction. Increased sales and availability are key factors in prescription growth. Very quick story, and I'll try to wrap this up. I was actually having surgery done, and the amount of pain medication that they gave me, 3 different bottles, a 90-day supply. It was over the top. Why does anyone need that amount of pain medication? And this is what the feds are closely looking at to help us make sure that there's a serious regulation on how doctors are prescribing. Increasing treatment admissions cuts the death rate in spite of continued sales growth. So here again is something promising and something hopeful. Getting people into treatment sooner cuts the death rate significantly. I want to go through this really quickly so that you can understand how complicated a heroin addict is. And so when you look at the heroin addict across the United States, and the reason why I say across the United States is what's happening in DuPage is no different than what's happening across the United States. This was on a sample of 29,000 people. And so 66% of the opioid addicts had 4 to 15 different episodes of victimization in their life. This is what that victimization scale looked like. So ever been abused emotionally, ever forced to have sex acts by family members or trusted ones, currently worried about being beaten or hurt. This was something that was we have to deal with as a person enters treatment. Some of our psychiatric issues. So ADHD, 95% of the clients that come into my agency and 95% of the clients that I see in private practice come in with, as an example, ADHD. Most of them have never been diagnosed with ADHD. They were diagnosed because of symptomology. So we are starting people on cross-addicting medication at a very early age. And so when you look at all of this, this is what we have to try to address simultaneously. Treatment programs must not only address the addiction, but the mental illness and the medical conditions simultaneously. So when you look at mental health disorders, 55% of opiate addicts will enter in with some type of mood disorder or anxiety issue. So it's not just the addiction that we're trying to treat, but some of the co-occurring mental health issues that go along with that. What we're also seeing, 57% of the clients that come into most treatment centers are referred by the criminal justice system. And you can clearly see here the type of crime that heroin addicts participate in. And so all of this are costs to society, and even more problematic in trying to treat that client, specifically those that are prostituting or gambling. So 44% of our heroin addicts participated in some type of violent crime. It doesn't start off that way. It finishes that way. So when you look at the intensity of justice system involvement by substance abuse, you can clearly see that a lot of our kids are being referred to treatment through the criminal justice system. We need to change that, because the only way that you're going to get people to move into recovery is to offer better and more treatment opportunities. And right now in the state of Illinois, we are actually having less treatment opportunities, less approval for inpatient treatment than we've ever seen. Count of major clinical problems at intake. So 72% of the heroin addict had 5 to 12 mental health conditions at the point of intake. That's phenomenal. And trying to address each and every one takes time. And so what parents can do, destroying remaining medications, do not reduce the message of risk potential. You gotta talk to kids, you gotta be open about it. Utilize treatment resources early on. Educate your children about the risk of addiction. As you heard tonight, many of these kids did not understand what heroin was. Many of them didn't even realize that they were taking it the first time. And for those of you that have addiction in your family, you gotta understand, or those that are in the audience tonight who has a father who's in recovery or is an alcoholic, you need to know that you will process drugs differently than your friends. You might have friends that have used it 1 or 2 times and said, you know what, this doesn't work for me, I'm moving on. And that's fine, that'll work for them. But you need to understand that biologically, you will break down the drugs differently. You will become addicted to those drugs where your friends would not. Access internet resources. There's a lot of opportunities here for education right on the internet. I will tell you something. I wish what's happening here in DuPage was happening across this country. They are having a cutting-edge approach to prevention. And that is through the state collaboration on training. There is a drug prevention strategy where a lot of the public officials of police and fire, as you heard today, are carrying Narcan with them as a way to stop the overdose from occurring. That is gigantic. That is a huge step in a positive direction in addressing this epidemic. As perceived risk decreases, usage tends to increase. And this is something that we need to fight, because every day in our papers, we are seeing that drugs are becoming not a big deal. And that is the biggest issue that we had when we created medical marijuana. The biggest issue is that we address this as this isn't a big deal. And what we've known for 25 years is that marijuana is a crossover drug. This isn't a debate. As much of what's been going on in the state that people want to say this is not a crossover drug, we have known this for 25 years. Let's have a civil conversation. This is about revenue. But do not give the message to people that this is not a big deal, because our kids' lives are at stake. There's even a larger problem with opioid use disorders that have already arrived. What you need to understand, the reason why Chicago's #1 is because we are the hub. Heroin comes into the city of Chicago and then spreads out across the United States from here. So of course we're #1. This is where the first point of embarkation for heroin is, in Chicago. While currently driven by prescription opioids, it's only a matter of time before this turns heroin, with likely increases in crime and health problems. Close to 80% of the people in Cook County Jail have a drug and alcohol problem. That's not where they belong, and that's not where our state resources need to be. Most have multiple co-occurring problems. Overdose prevention training, again in DuPage, you guys have done a phenomenal job and really, really need to have kudos for that. Understanding current barriers to treatment and adequate care. I'm going to sum up with this currently, and that is, right now, we have a lot of barriers for people entering treatment. And that is going to cause a serious issue if we as a community and we as a group do not take this message down to Springfield about the need to increase treatment services. And so right now, when you look at residential treatment services, where you have to address the mental health condition, the addiction, and any medical conditions, it's not available to everyone. And that's even in the publicly funded areas. And it's actually drying up at a phenomenal rate. And so in order to know that treatment works, we've got to be able to have a voice to save the lives of our children in this community, and that is that treatment needs to expand and there needs to be resources for it. Thank you very much.
Thank you, Dr. Lustig. Was I right about the depth of his knowledge of this subject? Excellent, excellent presentation. The point he made a couple times, I think bears repeating even again. The lack of knowledge of the threat that they're faced. The Roosevelt study that the Robert Crown Center participated in producing revealed that these kids don't know the extent of the threat. Make sure that you're doing what you can with your children to take that issue off the table. They need to know the threat. That gives them a much better chance. Our next speaker from the Robert Crown Center is Kathleen Burke. Robert Crown Center has been a leader and innovator for more than 50 years as the nation's first health education center. Helping children grow up healthy, happy, and safe is a priority for parents and communities, and it is RCC's mission. Kathleen Burke joined the center in July 2005 and brought with her an extensive record of accomplishment. Over the last 8 years as a CEO, she has revised the curriculum using current standards of best practice, introduced hands-on, inquiry-based teaching, new media and technology, formative and summative evaluation in an effort to improve the experience and knowledge of the learner. Once primarily a destination, the Robert Crown Center has evolved under the leadership of Ms. Burke into an important community resource for youth and the important adults who influence them. Over the past 3 years, Ms. Burke has stewarded an intensive collaborative effort to stop the increasing number of heroin deaths among our youth, introducing a new model of health education that is research-based, relevant, sustainable, and effective for both children and their influencers. And without further ado, CEO of the Robert Crown Center, Kathleen Burke. Please welcome her.
Thank you. I just want to take a moment just to, for those of you who don't know who Robert Crown Center is and who we were and who we've become. We've been around for over 50 years. Our purpose is to teach kids how to keep their bodies healthy, happy, and safe. Meaning, if you give them the fundamentals and you give them the groundwork on how to be healthy, that goes a long way in prevention of disease and chronic illness down the road. That's our goal. We focus on adolescents and from middle school and now into high school, because that's the age group that developmentally takes a lot of risks, because that's what they do. And so those risks are areas of sensitivity and are hard for people to talk about: sex education, alcohol, tobacco, and drug prevention, and now in general health, obesity prevention. That's what we're good at, and that's what we focus on. I want to point out the strategy that we use and why the way we approach education is very important and different. What you've heard tonight are the after effects of when this prevention message doesn't get into the schools and through our children's education. And I really want to stress that, because I think this conversation needs to turn around when you're talking about a dangerous drug like heroin. You need to start thinking about what we need to do first before we get into the problem, because it is an insidious problem that we would prefer our children did not have to go through. These are the kind of primary prevention approaches that we take. Primary prevention means that there is not a use. So we give you the knowledge, the education, and the skills that you need to make healthy decisions. That doesn't mean that you've tried it and then you're going to be secondarily taught that you shouldn't be making these decisions. This means that you're going to avoid it altogether. You're going to take personal responsibility for it. You're going to wear your seatbelt, you're going to wear your helmets. You're going to do the things that you teach your kids to ride a bike and normally to do, and you're going to teach them how to make social situations less risky for them also. Why did we get into this whole arena in heroin prevention? We have a drug education program. We've been teaching drug education since we've opened our new building in 1974, because it wasn't working. And it all started with heroin with a single question. A grandfather came to us whose grandson had died of a heroin overdose at 24. He sought us out because he felt that it was only through prevention that another life would be saved, because once use starts, it's downhill. He came to us and asked us, why aren't you talking about heroin? We stood there and said, why aren't we talking about heroin? Well, kids don't use heroin at this. Oh, yes, they do. And that was a surprise to us, and we're in the field. We didn't know this. It was so undercover and so wrapped around stigma. And so knowing what a teen's life is like, that developmentally they're normally at risk, their brain development, as Dr. Lipsig pointed out, is the part of the brain for decision making is the last thing to grow. Our children are under tremendous stress these days, and that stress has a physiological injury to them. And so we need to help them through that. And there are no bad kids or those kids. And when we first started talking in our community, I heard that a lot. I heard that not our kids, because our kids don't fit the profile of what kids who do drugs are. Well, folks, there is no profile. Every child is at risk, just because they're developmentally at risk, and just because we have a whole industry out there trying to help them start with their first drug. So what did we do? Well, the first thing we wanted to do was understand the problem. And as Dr. Lipsig pointed out, we asked Roosevelt University to help us figure out what was going on in the community now. Because the research was old. It was from the old days when you had heroin users that were mostly inner city, last-ditch drug addicts who were shooting up. That was not the face of the new heroin user. And so Roosevelt University talked to the kids who were using, asked them what they could have happen that would have changed their direction, who would have kept them off drugs. And we used that data to design our program in order to be more effective than our current way of treating drug education. We also knew that community awareness was one of the key points, and I'm so glad to see all of you here today, because the stigma that was keeping people away from admitting that there's an issue was part of the problem. That it was okay to say out loud that someone in your family had a heroin problem, or it was okay to know someone down the street who had a heroin issue. It was no longer a drug that you would never say out loud. But we also know that we could have created a program, and we could have done it in many different ways through good educational tenets, but it has to be evidence-based. It has to say that we're using the right information, the kids are learning it, and it's being effective. So for this is our second year, we've been working with schools in 4 different counties to test and pilot our educational component. And I'm going to tell you a little bit about that. But what's really important is that we're testing it to make sure it works before we roll it out to the rest of the community. Some people are anxious about that. Can we have it now? And it's like, I'm not going to give you something that's not working. And our whole goal is to stop heroin use by youth, to stop it. Not to reduce it, but to stop it. So we gathered a group of stakeholders and collaborators who all came together, all the folks at the table, representatives, law enforcement, coroners, all the people who knew something about heroin, and we were all dealing with it from different perspectives. And what we needed to do was have a common voice, to bring all the information and the data together and figure out what was going on. What we found, and Dr. Lipsig went over this really quick, I'm just going to go quickly, is that opiate pills, pain pills, are the fastest rise to heroin use in this country. And we have a lot to do as far as educating both ourselves and our physicians about that. We're working with DuPage Medical Group now, working to educate physicians on the impact that having those extra pills has on a family and in the future of a child. So we talked about heroin use, polydrug use. What are the contributing factors? They have minimal drug knowledge, because we don't talk about this. We also don't talk about drug education a lot in the schools these days, because first of all, the funding has run out for the schools, and in health, there are many subject areas that health classes are covering. And so drug education gets to be a smaller component of it. And one of the strategies we took was, how can we create lessons that can be integrated into other subject areas so that you can reach the common core requirements in literacy and math and science and psychology and all the other subject areas that could be talking about this subject. There is no understanding of addiction. For those of you who have addiction in your family, I bet there's not a big conversation about it. It's one of those hidden content areas. Everyone knows who has the problem, but nobody talks about what the problem is. And one of the most important things you can do is share that information with your children. Share that information that they are genetically predisposed to having more of a problem than their friends. So I particularly want to stress alcohol is one of the major issues with kids today, that we talk about that, because just because it's legal, just because pain pills are legal, it doesn't mean that it's not going to create chaos. So part of what we did was we tried to create a community-wide awareness program. We're on forums. We're at forums. We're in communities. We're trying to create the stimulus so the communities will gather around and be okay with us educating kids in schools. We had our first billboard. It was donated to us. But it at least brought the conversation in a big way. Some people didn't like this. I thought it was great. We could never afford that, our first billboard. So our education gaps, there's a lack of heroin-specific information. The school programs are, this is what our research study told us, the school programs half explain heroin and its effects because we really didn't know much about it when their lesson plans were created. And heroin was lumped together with all the other drugs. And one of the things I think is most important in what the kids said, you cannot lump all the drugs together and say they're all going to do this to you, because the kids don't believe it. They don't believe that marijuana and heroin are on the same continuum. And we need to stop lumping them all together and deal with the different continuums. There's stimulants, there's marijuana and alcohol, and there's opiates. And the opiates have a tremendous physical impact on your brain. So our new prevention model is what we've created. To test it, we created a cluster because we believe that we need to start teaching in middle school. When Dr. Lustig said age 15, age 15 is when kids start to use. We need to back it up, and we absolutely need to be teaching them in 6th, 7th, and 8th grade about what they need to know, so by the time they're faced with a decision and they're in a social experience that's going to challenge them, they have that knowledge. Now, developmentally, we don't teach the same thing to a 9th grader as we would a 6th grader, but we still teach them what addiction is, what heroin is, why it's dangerous, and what they need to think about. Clustering those schools together with 2 middle schools and a high school, we're looking at, as they go through the different years, that flow, and if we've made a difference by the time they get to high school. We go into a school and we talk to them about, what do you already have? These are well-resourced schools. They have outstanding health education programs. But what are you missing in this content area that we know that you need? We identify that. We've created all the lesson plans. We've created interactive experiences, and we have them on a web portal that teachers can download and add to their current curriculum. The purpose is to make it easy for schools to access. The purpose is to make it less expensive for schools to access and to not create a whole overlapping system on top of it, because it won't get done and it won't be implemented. So our research guided us on the design. The kids told us that they want authentic messages and messengers, meaning they do not want adults talking to them, okay? Especially the high school kids. They do not want to hear adults talking at them about the problem because they don't trust us. They don't believe it, and they don't trust us. Occasionally, they don't even trust the recovering addicts who come in and talk to them, because if it's too far removed from their world, they don't see it, and it's not relevant to them. And it has to be relevant to them. Right now, this place, because they don't see their future. They're only seeing right now. So we need to tell the story, the good, the bad, and the ugly. And the good is, when you start using heroin, it feels great, all right? It feels good. But then when addiction starts to take over, you start that slide downhill. And then by the time, and we demonstrate this through a whole year's experience, by the time you're in the full fledges of addiction, it's bad. And that drug owns you. But if we don't start out by saying it was good in the beginning, they shut us down and they don't want to hear it anymore. So these are the schools. This is the number of people that we've been working with. We have a wraparound program, so it's not just the student. It has to be the parents, and it also has to be the whole school staff. And the reason for that is, if children are going to be identified as needing this information, why would the adults in their lives not need this information? Who are they going to turn to when they have an issue if everybody hasn't been educated? In the same manner, everybody in the school lives in a different community. They go home to their community and they start communicating about what's going on. So we have a rippling of that community awareness happening at the same time we're trying to make sure the kids stay safe. This is an example of the online storytelling media piece that we put together. This is based on a real story of a young man who fought addiction and is still fighting addiction, and what it was like to go through an experience over a year. His addiction started with pain pills from the dentist, and we hear that more and more, and we hear more and more about athletes who also start down that pathway. And so here's the first step. And then we take them through a whole year of what it was like in their life. And we use language and text messaging and phones, and they interface with their community in the same way our kids interface now. And we made sure that happened. We tested it with the kids. We tested it with everybody to make sure it wasn't an adult saying, oh, of course this is how kids talk. So these are the 3 characters that are in the show, in the storyline: his girlfriend, Alex, and then a friend. And throughout the storyline, you're introduced to his boss at school, his counselor, his parents, his friends, and his girlfriend. And you experience how his life changes as he gets more and more into addiction. This has been tested, and what we found is that 83% of the kids like this interactive format. 88.8% found it believable. And 86.7% thought it was an interesting way to learn. All right, I felt like we scored here, because it's really hard to engage kids in an activity that they don't see through or they think is, just not fun. and particularly on a subject like drug education, because they don't want to be there and they don't want to hear it anyway. So you have to find a story that's going to engage them, and stories do that. The fact that it's online and it's self-directed and it can be a conversation point in many different classes has been very successful for us. So these are just some of the comments about it's interactive, it's not being told by a third person, they're discovering it themselves, which is great educational practice. And no one is telling or preaching at them because they do not want to hear that. Whoops, sorry. So what we did is we started out with finding out what the problem is, how best to solve that problem, and tested it and are still testing it. And when I started this presentation, I started with, why aren't we talking about heroin? Now I want to show you a clip about, look who's talking about heroin now. This is a technology switch here. So if you... So this is Celeste Napier.
The Robert Crown Center for Health Education. Recent initiatives by the Robert Crown Center for Health Education, a not-for-profit organization based in a suburb of Chicago, in conjunction with our Addiction Center at Rush University, is providing what I believe to be an excellent template for this goal. The Robert Crown Center is developing a completely new educational framework that integrates knowledge-building strategies for middle school, high school students, school personnel, and parents. Our center provides access to cutting-edge brain research. Thus, the prevention program includes both the neuroscience-based knowledge of how abused drugs act on the adolescent brain, as well as the social economic learning required to reduce drug abuse among our youth.
Dr. Napier was testifying in front of a subcommittee in Congress, and it was about science and technology and how you could get science and technology out into the field faster. Particularly, how could what we know in science help the methamphetamine epidemic that's starting to grow, but it also applies to all drugs. Dr. Napier works with us, has worked with us all along in order to take what's in her laboratory into our educational practice. So we've found a way to get science from the laboratory immediately into the classroom, which for all the academics in the audience, they know that that is an extremely hard thing to do. And her practice focuses in on what does drugs do to the brain. And so we're very, very lucky to have her with us and to have her teaching with us. So I want to thank all of you for listening. I know it's been a long night, and I can see everyone starting to get a little tired. I don't know why we start prevention last. I would really like to start education at the first, because it's the first step in preventing all of you guys from getting invested in any of this. So thank you very much.
Thank you, Kathleen. That was outstanding. And now, before we go to questions, which we'll do quickly, we've been encouraging you to take this knowledge that is power and share it. And we want to try and have an opportunity for you to do that in sort of a condensed way. And we have put together a video. It's about 3 minutes and 40 seconds or so. It's on YouTube. And if there are people you think need to hear this and people you want to share this message with, here is the YouTube video that we hope you will help send viral. What we're doing tonight is having an event to raise awareness of the threat of heroin in the suburbs.
And so the goal for tonight is to really try to get parents to understand about what addiction is.
To make sure their kids understand this is a potentially one and done drug, and if you see it, run like hell.
It's a very big problem right now. Chicago and Illinois remain a hub for heroin.
We refer to it as the Heroin Highway, I-290, from the west side of Chicago to the suburbs, where heroin is moving every day out into these suburbs.
Previously, heroin was taken via injection, right? The thought of putting needles in your arm just usually turns most people off. Okay, now it can be snorted and it can be smoked,
which in turn makes it seem less scary to easily influence teenagers.
You'll notice that the perceived risk has dropped. Whenever we see a perceived risk drop in this country, you've seen the use of drugs increase.
There are a lot of people who would be in denial about the fact that this is a suburban problem, and the truth is it is a suburban problem.
One of the research studies shows that over 95% of our children begin an opiate addiction by legal means, meaning that they've taken pills from their parents that have been prescribed and began using it, and it continued from there. There is a very quick solution, and that is dispose of those medications if you're no longer using them. Dispose of them, because your children are getting to them.
My oldest son, Jimmy, passed away of a heroin overdose. He struggled with heroin addiction for about 9.5 years. He was in 8 rehabs, sober living. We tried all the treatments, methadone, Suboxone. On August 16th, I was the last one to see him. He came home from dropping off Maureen, that's his girlfriend. He looked up at me with these big blue eyes and proceeded down the stairs. I went to work, and about an hour and a half after I was at work, I got a call from my daughter who had been home, and she said, "Dad is downstairs yelling. Jimmy, wake up," over and over again. Well, I got home about a half hour after that, and the ambulance was pulling away with no lights on. And my daughter was at the top of the stairs, and she said Jimmy was gone.
Heroin is a very serious addiction, and getting off of it is even more serious. When you're talking about addiction, there are only 2 outcomes. Either a person goes into recovery or they die.
Some people think that tough love is the key, while others might say tolerance and patience is the answer. But the truth is, there is no right answer. This is an epidemic. Drugs do not discriminate, and no family is immune to this disease.
Talk to your kids, understand that there's a problem. You know, it's not like when we were kids where, you know, people weren't using heroin like they are now.
What you used, heroin, cocaine, whatever that experiment was as you were growing up, is not the drug that's used today. The purity has increased over time.
Make sure your kids understand there's a lot of mistakes you get a second chance from. Heroin's not one of them.
Warning signs are there, and don't think it can't happen to your child.
Again, this video is out on YouTube, and it's interesting. Dr. Lustig and I were talking a little bit before about the video, and I said, you know, I don't want to show it before you speak because you've got so many good things. And the point of the video is to give you a condensed version of tonight so that it makes it easier for you to share this knowledge and this information. It's out on YouTube. You can call our office if you need the link. We are happy to share it. One point I wanted to make, I was remiss, Bob referenced Representative Rebelletti, who has really been a stalwart in Springfield on these issues. He was here briefly tonight in the back of the room, but was not able to stay. But I wanted you to know he was here with us tonight. And with that, first, why don't we give our panel a round of applause. And at this time, if anybody has any questions for any of our panelists, yes, sir.
Robert Crown Society, their organization does a great job. My daughter's been in it for a long time now. This program is great for schools. It's going to open it up for parents. Schools are great. It starts at home. I need this information in my household, not coming from the school.
You bring up a really good point because we've had the worst time gathering parents when we need to talk to them. So we're looking at other alternatives like putting it online for parents to access in their own convenient way. I'm looking for suggestions from parents because you're a tough audience and I don't know how to deal with it.
Starting with passing out the links here would be a great place to start. The conversation of bringing it back to my community, you know what, my daughter goes to school. Me walking into that principal's office and saying, you know what, I got this from Robert Crown, that's a big statement saying it came from Robert Crown.
Thank you. Go to our website, www.robertcrown.org, please.
Is it available now for the
Yes.
general public?
Well, the actual content
Yes.
is not, but the description, and Joan, my communication director, is right, that it will give you some information. But all the research is on there, the description of what we're offering, everything's on there except the lessons. And we have opportunities to look at the lessons. If you're interested, we can give you a password to do that.
Kathy, would you recommend parents going to their principal and saying, have you seen this? Have you implemented this in your health class? Are you aware of what Robert Crown has from a prevention standpoint?
Absolutely, because what stops principals often are parents who do not want it in their classrooms. And so it's very important that the silence around this stop, and that you let the principals know that this is a really important subject and you're behind him or her all the way.
Yes, ma'am. Right here.
I appreciate everything that you do too. I lost my son, and we're all angry around here. Oh, I'm sorry. Oh, I'm sorry.
If you have a question, if you could come to the sides.
Okay, I just really quick want to let everybody here know about a resource that is available to the school systems. One of the biggest challenges with our program, it's called Stand Up Change Teen Statistics, is actually letting the educators and the people in charge know that this program is available to them. We have served 75,000 kids over the past 3 years, and it has 86% of the kids who see this program say that it makes a tremendous difference in their intentions and their behaviors. There is a 28% of the kids who see this program actually go and get help. It's research-based, it's award-winning, and it is proven to be extremely effective. We just presented at a educators conference in Indiana. We're ended with a standing ovation. I think the educators are very excited to learn about that there is something unique and something, it is a peer-to-peer program, which is the Robert Crown philosophy, and it seems to really work. So it is available to you, and I will have this, if anybody's interested in learning more about it, I'll have these for you. Thank you. And you guys are awesome. Thank you.
Thank you very much. Yes, next.
Thank you for bringing us up to speed so quickly with this epidemic. When Dan was mentioning his concern or disbelief, even frustration with the 90-day supply of pain medication, I didn't get a sense of strong apprehension. And given the impact that prescription opioids have with forming a habit for heroin, I don't know law, but it's great to have a senator here who might be able to consider this. Along with the accident that causes the prescription for the pain medication, there's typically lawsuits that might be involved and payments with regards to those lawsuits, sometimes in terms of penalty, not just in terms of damage done to the person, but a penalty, a large penalty assessed. And what I'm wondering is if on just that penalty, in just those cases, if there could be a stipulation written into law that says there will be a fraction of this penalty which is in jeopardy relative to pills that escape from your control. In other words, if the pills were to carry, let's say, a $2,000 penalty for each one lost, first you would have a great deal of apprehension in bringing home that 90-day supply all at once. You would make the trip to go back 2 or 3 times to get your monthly supply every month. And secondly, you might lock these somewhere and prioritize locking them, and then you would dispose of them, especially if these pills were marked or traceable to who it was they were prescribed to. Again, I don't know if any of that is legal, But if it is, I think it might be a worthwhile pursuit in terms of creating a sense of apprehension regarding what might happen to these pills if you don't maintain control of them.
Well, there's no question that and as Dr. Lustig pointed out, and Ms. Burke pointed out as well, the knowledge of the risk inherent in keeping those pills around after they're no longer needed is something that needs to be expanded. That's one way in one arena to possibly do that. That's certainly a laudable goal, no question about it. Yes.
Hi, sorry about that before. I come from Genoa, Illinois, and I'm telling you to get into the schools, it's impossible. I say one is an epidemic. What are we going to do to try to get past that? There are too many people putting their heads in the sand, turning away and not wanting to recognize the problem. All this sounds wonderful what you're doing, and I know it takes so much time, but truly, from working on this for a year after I've lost my own, I think what really needs to be done is to scare these kids so damn bad that they don't even think about wanting to try it. All this is sugar-coated, and it's great, and I applaud it, but it's not going to stop the kid. You can talk. They have McGruff dogs, rough, you know. That's not reality. That's not reality. Reality is bringing home an urn and showing these kids, or showing them pictures of addicts. You know, there's quadriplegics. There's all kinds of people that these young kids need to have impressioned in their mind so they never even think of trying this.
So let me just answer that briefly. I think what's really important about what Robert Crown does and treatment programs does, what we've learned over the course of the last 15 and 20 years when it comes to drug addiction is that the scare tactics don't work. What it does do is it suppresses behavior. And over time, the behavior returns. And so what you get is an immediate reaction of being afraid of it, but as time progresses, it doesn't do anything. The behavior comes back and the craving for the drug occurs again. So that's the challenge I think that we have here, is that many police departments like to use scare tactics. But we have to grow from that. We have to really, really grow from that. I'm really passionate on this topic because all scare tactics do is it suppresses behavior. And so getting into schools is an important first step. Making sure that we are using evidence-based interventions. That's the key thing. It's not just going into a school and doing a presentation and hoping for the best. It's using interventions that have been proven effective is what is different this time.
I also want to point out that the state just has a heroin task force that was appointed for education to understand the best way to address education in the whole state. So that is pretty progressive, and I'm hoping a lot comes from that.
Yes.
Hi. My son is a 2005 graduate of York. He graduated as a heroin addict, and I'm very glad that he graduated. And, I wasn't going to cry. But similar to Captain Roberts, I got that call that said, but for my 11-year-old daughter, saying, your Nick's not breathing. I was lucky. The Elmhurst Police Department saved my son's life. But since 2005, and that was the first I knew he was an addict. I didn't understand what to look for. I didn't know his nodding. We didn't talk once here about what that nod is. That's a physical thing that I could tell you who's a heroin addict by looking at them right now because I know now. But I didn't know he did it all the time. I'm tired, Mom. And I missed it for a year. I lost. And that time is so important. But he relapsed 13 times. He's still alive. I'm very fortunate. He's in DuPage County. He's going to prison. He's got 3 felonies. He'll never work. At this point, my life is, I'm never relaxed. I'm relaxed now for the first time because he's in jail. It's a horrible way to live, and the effects to the family are so huge. Now, we sit here with 100 people in this room. This is great, and we got to get the word out, everything else. But my daughter, fast forward, she becomes a freshman 4 years ago. She's now a senior at York. the question was raised about the heroin highway, and the response was, don't worry, it's only 3% of our school population. That was literally what they said. It made me break down in the middle. They said, worry about the alcohol. You know, everyone here knows what an alcoholic, a drunk looks like. You probably all know who someone who smoked pot is. Not that you ever inhaled, but everyone probably knows. You know, but will you know if you see someone who is high on heroin? You won't, because you don't get it. But it was shoved under the carpets. And to this day, my daughter, who is a straight A student, wonderful, she's gone through hell, just like I have. You know, she said, Mom, I can go tomorrow and buy heroin. People don't get it. No one gets it. And there is a stigma. I don't care. Everyone says there isn't. But why did they want that billboard down? Because there was a stigma. For me to say my son's a heroin addict, I can do it now. It's been what, 7 years, 8 years? And now I can finally say it. And it took long because people look at me and they look down at me as if I was a bad mother, or I was a bad this, or I must be this. And I'm just like everyone else who's from Elmhurst. I live in Elmhurst, this great town, this great community, you know, but it can happen to you. But I don't know what the answer is, but it still to this day is happening. And my biggest frustration, and I guess that's not even a question, is going back to 2005, and we're at this exact same place, I feel. I don't think that we've made the progress we can, and we need to figure out how to fast forward to make all the parents not have to go through what I've gone through. I'm lucky my son's alive, and there's so many people here whose sons and daughters aren't, but my life is so impacted, and it will be for the rest of my life. I'll never, ever relax again. So, no questions, just comments.
Thank you.
Yes.
This is our last question.
My son also died of a heroin overdose October 27th of 2012. He was raised in Elmhurst as well, moved to Lombard when he was 18. He was only 21 when he died. Kind of in brief, just, it's quite of a long story, but the first I would know about his heroin use would be in June of 2012, and he was dead by October. Went to rehab. After the first overdose, I did find him in my house. And boy, goes to rehab, and I had him under my medical insurance plan. Those counselors work so hard, begging the insurance companies. They are on borrowed time from the moment they walk in that door. And you're shaking your head because you know. We'll approve 3 days. We'll approve 5 days. Fearful the whole time. Mom, I don't know how long I can stay here. You know, you told me I can't come home. I don't know what I'm going to do. And they fight every day, every day, every day. He was allowed to stay 21 days in June by my insurance, approved. They would not approve anymore, and he got 7 days of charity care through Gateway Foundation. And my son relapsed in October. He got 14 days approved through the insurance company. No charity care. There was nothing left. He died of a heroin overdose. So went to sober living, which is never a good idea. Halfway house, halfway house, halfway house, more support. But yeah, I guess my question is, I know there's a bill on the books. Government mandates the health insurance companies to cover up to 45 days per calendar year. It's not enough. It's not enough. They go on borrowed time. It's hard enough to get them in there in the first place. It's just not enough, 45 days, and I just want to know what can be done about that. I've emailed, I've written letters, and something needs to be done. I paid dearly for my health insurance, and I work hard every day of my life. And, you know, I don't know, would my son have made it? I don't know, but I'll never know that.
So let me just comment briefly on that. So we have some good things on the horizon, albeit bumps in the road getting there. So one of the things that the Affordable Care Act is giving addiction providers is something called parity. And that addiction has to be on par with how we treat medical conditions. So that's a law. Now, the problem with this is I suspect over time there's going to be a lot of parity lawsuits, 2 of which I know are already going to be occurring. So we have some good news is that some of the legal language is saying we have to be on par with medical, which has never happened before. We never, ever had that before. Getting insurance companies to follow suit is going to be a challenge, because one of the things that Illinois did is they exempted managed care companies from parity. So what you can do is continue to inform and continue to inform your politicians about this. This is what's really critical. What a lot of people are not getting is we've made great strides in the last couple of years. I think people are listening more. I think some of we have more dedicated, passionate politicians who have really carried water for us. I think Senator Murphy is one of those people that have really done an outstanding job at carrying this message. So there are people that are turning around. The important pieces about this is that talking about it's important because of the stigma associated with addiction. No one used to talk about addiction. We all stayed in the dark. And so, because nobody wanted to talk about it, because the founding principles of Alcoholics Anonymous is to remain anonymous, it's hard to get this field moving forward. But we have made great strides, but you do have to voice your opinion around parity. So on one hand, we made great strides. On the other hand, we've taken a couple steps back. But we have made some progress.
So I have to write the correct politician.
Absolutely.
Anyone,
haven't gotten an answer from anybody yet. So
anyone that represents you. But it's you know, it's an issue that I think it's a growing problem, but it may not be the call we get most commonly to our office. And if you can get yourself and some of your friends to contact your local officials about it, it creates the impression in our office that this is something that we need to get on our radar and do our homework on and understand a little bit better. So I mean, there's an educational component for us too. So to the extent that you can do that, it can be helpful. We can make a more informed decision because our job is to represent you. And to the extent that you're letting us know what it is you need or aren't getting currently, we're in a better position to do that.
Yeah, it has to be treated like an illness. It has to be.
Go ahead and target those people on the Human Services Appropriations Subcommittee. Greg Harris is the chair. Target those people because they are the ones that are appropriating money. Those are the people that can make changes occur.
Oh, and if you want money from the state, this is a bit of a commercial for pension reform, because the truth of the matter is Illinois has to put a larger percentage of the money we take in. And by the way, the state right now is taking record revenue in taxes from taxpayers in the state. State has never had more money than the state has right now. And the state currently has to provide the largest percentage of that largest amount ever to make the pension payment. We're drowning under it, and it is skewing priorities, and this is an example of one. With that, we'll conclude this evening's, oh, no, we've got one more. I apologize. Yeah. Yes, the conclusion. Thank you all very much for being here. It's my pleasure to moderate.
Well, thank you to everyone for coming to our panel discussion on the Heroin Highway. Our special thanks go to our moderator, Senator Matt Murphy, and all those who served on our discussion panel, State Attorney Robert Berlin, Kathleen Burke of Robert Crown Center, and Dan Lustig of the Haymarket Center. We also want to thank Captain John Roberts of the Hero Foundation, and thank you to Laura Anderson of Winning Systems for her assistance this evening. Please visit our literature table in the back of the room, which has additional information on the Haymarket Center, the Robert Crown Center, and the Hero Foundation. Elmhurst College is noted for its forums, speakers, and literature series. Our current series, Fixing Illinois, leaders from across the state discuss problems the state is facing and offer their best way to approach and resolve those problems. On Monday, September 30th, Senator Kirk Dillard will be our next speaker. Please join us here at 7 p.m. as Senator Dillard will speak on making Illinois a destination economy for job creation and families. In the back of your program is a list of other upcoming events here at Elmhurst College. Thank you again for joining us this evening.
Thank you.